So this segment, we're going to deal with sickle cell. Sickle cell anemia, I was involved at about 10, 15 years ago, 20 maybe longer, with May Osborne, may she rest in peace, where we would go to, we had an event at with late mayor when Jim Seals was the mayor, had Cathedral Fresh Fire where we had kids, we brought them gifts. Then we went out to the Children's Hospital, and it's kind of touching, and again it affects our community. So I have the authoritarian, the good doctor. How you doing, Dr. Nina?
Thank you. Thank you for having me today.
Thank you. So how did you? Let's go right at it, right? How did you get into sickle cell, and what I know it's a trait, right? Mm-hmm. What exactly is a sickle cell disease?
So sickle cell anemia is a genetic inherited blood disorder, and the blood cells are shaped a little differently. So a nice red blood cell is round. It moves through the blood cells very easy. And those with sickle cell make cells that are shaped like a C. They're hard and sticky, and they don't live very long. And so under certain conditions like stress, being sick, they actually clump up in the blood vessels. Oh. And when you're not getting enough oxygen and nutrients to your tissues, your organs, it can cause damage to the vessels, but it also causes excruciating pain and damage over time.
How does one contract or catch sickle cell?
So you don't catch it.
Okay.
You're born with it. It's a genetic disorder. And actually, when I tell people this, that those thousands of years ago that actually had sickle cell disease or the trait survived another pandemic called malaria. So malaria killed millions of people worldwide. But those who carried the sickle cell trait or had the disease, the malaria parasite couldn't penetrate in the host cell and replicate. So those people actually survived, and then they passed on those genes.
So is it a blood trait?
Not really a blood trait. It's a genetic disorder that affects the way the blood cells express themselves.
So you would probably caught it from your great-grandparent or your parent, or just happens?
It's passed down in your genes. So for example, one of the things that I do in my practice, we have a point of care test in which we screen and make sure that people, especially African Americans, because 1 in 12 African Americans can carry the sickle cell trait. So
is that high?
Yes. So if you look at if you go to church, for example, and there's 50 people there, there's probably about 2 or 3 that carry the sickle cell trait.
Wow, I didn't know
and unfortunately, sometimes they don't know they have it.
Wow. Well, how do you know?
Well, it's you can get tested for it, as I was saying.
I mean, do you sit up and then you just start feeling fatigue or loss of breath? I mean, are there any symptoms?
Well, let's just first start back that in 1990, across the country and over now 50 states, the newborn screening program actually tests newborn babies for sickle cell trait, and other inherited disorders that can be something that needs to be treated right away, because then they could have unintended problems. So most babies in the United States are screened at birth, and they know within 2 weeks whether they had it. Now, if you're someone my age or older, you may have not been born, after 1990.
So let me get this right. So right now, today, right, since 1990, this is what I'm hearing you saying.
Around the 90s, yeah.
Around the 90s. Every child who is born gets a sickle cell test, or do they have to ask for it? Or is it mandatory?
It is mandatory, yes.
Wow, I didn't know that.
Yes. So, our generation and those older, you may have not been able to be screened as a baby. And so we may not have known that we had carried the trait or had the disease.
Is there any medication?
Yes. And that's one of the things I'm really grateful to report, that the FDA has now approved 3 new drugs or disease-modifying therapies that we can use to treat those with sickle cell anemia. And also gene therapy is in phase 1 early clinical trials, offers the opportunity for those to be cured of their sickle cell anemia.
How long have you been doing this, Doc?
I don't like to reveal my age, but I would say 20 years.
You've been doing this for 20? No, I mean, because you're very knowledgeable, of course. I mean, so you've done work out of the country with this too, right?
Yes,
Tell me about it.
yes. So I was actually honored because I represented the United States in Korea, South
Oh
Korea,
wow.
and I went there to talk about the importance of African Americans being blood donors, especially for those with sickle cell that require chronic transfusions. And unfortunately, in our community, only about 1% of us actually donate blood. But those with sickle cell anemia are best likely to match those of African American descent or
Right.
African descent because in our red cells we carry information that's genetically similar to those with sickle cell. And for those who are on chronic transfusions that have to get blood supply on a monthly basis, they can develop severe transfusions reactions, or they can develop antibodies which can be life-threatening. So I was charged to share of the importance of improving the diversity of blood supply for those with sickle cell at a conference in South Korea.
So people with the sickle cell trait, they basically need blood infusions.
Not with the trait, but those with the disease. So
What's the difference?
the trait means that on one of your chromosomes, you have two, you carry a sickle gene and then you have a normal gene. So those with sickle cell trait don't have usually symptoms of sickle cell disease, but they carry the genetic information that can be passed on to their children. Those who have sickle cell, they carry the sickle gene on both of their chromosomes. So it means that they get severely ill, they can be severely anemic, they can get sickle cell crisis, multi-organ damage over time from these episodes of crisis.
Wow. Ladies and gentlemen, I hope you're enjoying this. You're looking at Community Crossfire, another point of view. We have another very, very smart person. All these people are smarter than me. I gotta start dumbing down, you know. But I mean, this is good information about sickle cell. So this picture, what does this represent?
So I had the opportunity to have this commissioned by an artist out of Chicago named Craig Smith, and it's called "In the Struggle I Rise." And one of the things that we are doing at TOVA is we have the opportunity to sell 100 of these prints for anyone who's interested in purchasing it. It's a 9x18. But if you can look very closely, you can see the little tear on the young man's eyes. But this is something that those with sickle cell express, that, you know, a lot of times they feel like it's a silent chronic condition. They feel there's stigma involved with having it. And so in order to raise awareness about the importance of making sure that there's equitable resources in treatment and research and develop for sickle cell, we are selling them for $75. And if anyone is interested in purchasing them, we can go to our website, which is www.tovacommunityhealth.org. The other thing is it looks very nice in your home, and as we get ready for the holidays, it's a really nice purchase. And the proceeds go back to TOVA to help our clients in our practice.
I'll certainly buy one.
Thank you.
So what is
Appreciate it.
TOVA? You said TOVA?
Yeah,
Spell
so
that.
TOVA, T-O-V is in Victor A, in Hebrew means good.
Okay.
And so
Do
one
you
of
speak Hebrew?
I don't.
Okay. I'm not going to say that you Hebrew everything, got everything going on.
Yes. So one of the things that I've been championing over the years is to make sure that individuals in our community had access to high quality of care. What I found was the bar was set so low. And when they would go to the hospital, when crisis, sometimes they were mistreated, they weren't provided with the appropriate dose of medications to stabilize their pain. And so I wanted to focus more of a holistic, comprehensive model where that they weren't just treated for pain, but sickle cell involves treating the whole person. And so that's one of the things that I was challenged with to do. And I was also very fortunate about 6 years ago, I leveraged a partnership with Johns Hopkins University. So they also
How does that
manage my
work?
patients.
So you were Johns Hopkins University?
So Johns Hopkins, I'm a satellite.
Wow.
Actually of them, and I early on used telehealth technology in which I would work with the doctors, a hematologist at Johns Hopkins, and they would help me manage my patients here in Delaware.
Wow.
So we've been doing this now for over 6 years. Before COVID, there's been this mass surge of using telehealth and telemedicine platforms to serve patients to flatten the COVID curve. I've been doing it for over 7 years, and it actually won me Delaware's Small Woman-Owned Business of the Year, the motto I created with them.
Wow. So you have your own practice?
Yes, I do.
Wow, that's pretty cool. So you said something about COVID. So does COVID affect? Does it have any kind of adverse effect with a person with sickle cell?
Yes, it does.
Wow, that's sad.
Yes, and with African Americans as well, we're at higher risk of suffering poorer outcomes. And I had the opportunity to have one of my patients participate in an epidemiological surveillance program that was started by hematologists in Wisconsin. And I say a couple months ago, he reported that data to the CDC, in which we had about 268 patients across the country that developed COVID with sickle cell, and a 7.8 morbidity mortality rate. So very, very high. And I actually had one client of mine develop COVID, a moderate case of it, but she actually survived. She had to get transfused, develop a severe acute chest, but was able to be stabilized.
Is it a painful disease?
It's very, very painful. In fact, as an adult, 30% of patients live with chronic pain. That's pain that they have every day of their lives.
Wow. And do they have to take medicines for the pain? So they get, talk about the medicine part, if you can.
So, yes, typically with sickle cell pain crisis, we really didn't have many options in which we could offer patients. So we were treating symptoms, IV hydration, to giving them transfusions, to giving them opioids. One of the things that
Sign me up for the opioids. What about medical marijuana? Does that help?
For some patients, it can help, but we don't know what the long-term effects of marijuana are. So we're very careful in making sure that our clients understand that. But my philosophy is we do everything we can to make sure that the patient lives the optimal quality of life possible. And one thing unique about my practice is I use a very holistic approach. So we use minimal amounts of opioids to manage my clients with sickle cell with chronic pain.
Ladies and gentlemen, I hope you're enjoying this dynamic and interesting conversation, because she's saying words I have no idea what the hell she's talking about, but it sounds good, so I got to act like I'm halfway smart. But you said something also when we talked off the camera, right? I remember when I was involved a little bit, right, that people, their lifespan was kind of shortened. Mm-hmm. You told me now you have patients up to 70 years old. Mm-hmm. Is that because of new medicines?
Yes, as I was saying, it's very exciting. Hydroxyurea was a new medication that was the first drug FDA approved for sickle cell. That came into effect in the 1990s, but now we have 3 more and more coming down the pipeline. So, back, let's say 20 years ago when I first started, we were really excited to see our patients live to 20, but now they're living much, much longer. And I always share that my oldest patient passed away last year, Mr. Edwin Russum. He was also very involved in the Sickle Cell Disease Association in the 1960s when Ray Evans, my uncle, who also did a lot of advocacy work with, he was 78.
I didn't know Ray was your uncle.
Ray Evans.
Yeah,
yes.
he was a real advocate. I mean, just a community advocate, from, the Mary McLaughlin and all those kind of guys, Haskell. Good Republican, by the way.
Yes, he was a great Republican. I hate to say.
I know my history.
I'm bipartisan.
I know my history. I got you. I got you on that. But God, I didn't know it was that. I'm serious. First of all, I didn't realize. I realized the impact, but not to this degree. I want to go back for a second, right? If I can. So, did you start out working like in Christiana Hospital or Wilmington Hospital or St. Francis, and basically said, "Look, I could start my own practice"?
I actually started working at AI DuPont Hospital for Children, taking care of children with sickle cell anemia. And, at the time, it was always some like stigma with the healthcare providers where they would say, I don't really want to, take this patient because they're difficult or, they're, just hard to manage. But I looked at it as an opportunity. I'm like, these young kids are suffering and they need help. And if we don't provide the care necessary, I mean, what does that say? And then I went back to get my master's, and I had the opportunity to work at a comprehensive sickle cell center, which actually got funding from the National Institute of Health, which was one of 10 centers in the country that were funded. And I said, hey, this is a great opportunity to work with world-renowned doctors that are really providing high-quality care. And there were also at the time really working on a lot of research in clinical trials to really push new medications so that we had more therapies to offer those with sickle cell. And I think that was one of the pivotal moments in history that really helped to get these young kids living longer.
Say that again. Because you said it was a pivotal moment. So what happened again?
So the National Institute of Health funded 10 comprehensive centers across the country. Wow. And the Marian Anderson Comprehensive Sickle Cell Center and the Children's Hospital in Philadelphia were one of their funders.
Wow, that's amazing. God, ladies and gentlemen, I'm so impressed with this. So how can a person, do you just take referrals? Is that how it works? Like if someone wanted to contact you, right, because someone in their family had sickle cell, right, can they get referred to you?
Yes.
And what if they don't have insurance? How do that work? How does people pay, or how does it work?
We still take patients that don't have insurance. We will work with them on a sliding scale with what they can afford. But I've been very fortunate because I am a salaried employee of my company. My mission is to provide the care that patients need. So we work with anyone
Good for
that
you.
needs the help.
Do you get grants too? Do you apply?
Yes, I do. You know, they're hard and few to come by, but we also try to sustain our program with grants as well.
Where do you see this movement going? Because you said you've seen so much that have changed 20 years ago. Where do you see it going in the next 20 years?
Well, I think the sky is the limit. I think with social media, the awareness of sickle cell is just, it's exploding. You know, you see young people sharing their journeys. There's lots of organizations that are evolving that are actually trying to provide more resources, making sure that their members get access to care. And very early on, I wear a lot of red, not because I do like the color red. It also means love, but it's also the color of blood. And so I really see a surge of that as well. You know,
you said because of love?
And the red is the color of blood.
Oh, right? I like the color red because I'm a Kappa.
Yeah. I think it's going to become more global. And when I was in Korea, when I represented the United States of America, we think about all of the countries that have those who are living with sickle cell. And even in India, there are many, many.
Have you been to India?
I have not yet, but I do want to go there.
I believe you. I mean, sounds to me like you're getting global, like worldwide. Yes. You know what I mean?
Yes. Mm-hmm.
And probably. So, do you do many speaking engagements?
I haven't since COVID, but I.
But you used to.
Yes.
Like
outside of Delaware, yes.
Well, just do seminars.
No seminars, but that's a great idea. I've done a lot of virtual forums. I did one for World Sickle Cell Day in June. June 19th.
World Sickle Cell Day is June 19th?
Yes, and I did a virtual forum with a partnership with the We Love You Foundation. They actually paid for my way to go to Korea, but they're an NGO that has over 250,000 members, and they're in about 50 countries across the United States. And that was a great partnership. We actually had about 1,000 people that attended the forum from as far as Russia to Angola in Africa.
Wow. So do you have a staff?
I do.
How many people on your staff?
I have 4 people on my staff. I'm really grateful for that. You know, being a small Black-owned business.
No, this is fascinating.
It's challenging, you know, especially the population that I serve. We really have to be fiscally conservative, but also look for opportunities to expand. But yes, I do have a staff. They're very well trained, and they're very passionate about serving the community.
Where's your office located?
I'm right down the street. I have an office on 213 Green Hill Avenue. It's actually located at Family Medicine at Green Hill, which is a patient-centered medical home. And I'm also a senior research fellow at Delaware State University, so I have an office there. I know you will like that.
All this stuff is coming home. God, Dr. Scott, Dr. Nina, this is very impressive stuff. I know Julius, your husband. I got to give Julius a shout out. But I didn't know how detailed what you were doing. And I'm very honored and proud that you came on here to talk about an issue that's so sensitive, but so necessary.
Yes.
Because we just don't get that information out, right?
Right. It's very important that people know. I'm always say I'm proud because I grew up in Wilmington and I came back to serve my community. And this is something that my father, Ray Evans, my uncle, would be very proud of.
Well, I tell you, you have a athletic family. Phil Anderson, they tell me your dad was very athletic also.
Yes. He held the record in the half mile at University of Delaware for 30 years. And he was also on one of the winning 4x4 teams that
That's right,
Bob
I saw some pictures.
King.
Bob King, yeah.
Yeah.
Is his first name Phil also?
Yes.
Wow.
So he's a Howard Wildcat, my dad. Yeah.
What school did you go to, high school?
I went to John Dickinson High School. I'm proud to say I'm a public school graduate. And then I went to University of Delaware for my
good for you.
bachelor's and master's degree.
But I thank you. Is there anything you want to cover again?
Yeah, I just want to say thank you for having me on the show today. And also, my company owns the trademark for Sickle Cell Lives Matter. And that's one of the other things that I have done to really try to reduce the stigma of sickle cell.
Wow.
And for those who have the condition, to be very proud and to know that we are, I love my patients very gracefully, and I want them to, this way, you see? And Sickle Cell Lives Matter, my company owns the trademark, and we sell these T-shirts.
See, not only are you not only you're a doctor, you're very smart. Like, I'm going to get the trademark.
Yeah.
And since I'm going to buy a picture, I'm going to take a shirt too. But that's some good stuff.
Yeah.
You ought to be, I'm serious. Like, I'm very proud of you.
Thank you.
Because, again, I know I worked with it. A little while. Like, probably like a few months, because we did, I think, again, we would do Christmas parties for sickle cell patients, and what you're doing is phenomenal.
Thank you.
And I'm sure like most people would know somebody who are sickle cell patient. Like I know someone, one of my friend's daughter. And I won't mention his name.
Yeah.
But it's real.
Yes. Very much.
Do you have a phone number, a website, or email address?
So my website is www.tovacommunityhealth.org. You can also find us on Facebook at TOVA Community Health or Instagram at TOVA Community Health. And our phone number, if you want to reach us, is 302-429-5870, extension 120. Be happy to help.